So we'll go ahead and get started. I see Morgan is just jumping in there. So actually what we'll do is this meeting calls to order the regular meeting of the Boulder County Board of Health. The time is now 5:31. It is Monday, June 14th, 2021. I'll ask all board members to introduce themselves. I'm Greg Thomas, Board President.
This is Landry Fagan, board member.
This is Brooke Harrison, board member.
Morgan McMillan, board member.
Good evening, everyone. All right, Lexi, would you do the honors of our special guest and all the wonderful staff?
I would be happy to. I will start with our staff who are on the line. We have Chris Campbell with us here tonight. We have Tammy Golden. Kate Haywood is providing, serving as our legal counsel. Daphne McCabe, our head of family health, head of the family health division. Let's see, who else do we have? Trina Ruland is on the line. Angela Simmental with communications. And I think that's everybody that we have at the moment. If I missed anyone, please speak up.
Camille Rodriguez is here.
And here we go. That launched us right into the next space. Thank you, Camille. So I'm Lexi Nolan, Deputy Director at Boulder County Public Health. Good evening, President Thomas and Vice President DeSantiago, Ms. Fagan, Ms. Harrison, and Ms. McMillan. I am very pleased to introduce you this evening to Ms. Camille Rodriguez, Boulder County Public Health's new Executive Director, whose first day on the job was last week. Camille comes to us from Illinois. She has more than 20 years of public service experience. Prior to joining BCPH, she served as the McLean County Administrator. She has extensive expertise and knowledge in public health, creating systems that reflect diversity of the community and promoting equity and inclusion. Camille also previously served as McLean County Health Department Administrator and worked in Wisconsin State Government in Public Health in the Division of Long-Term Care. She also served 10 years in the Illinois Department of Children and Family Services as an investigator. In Wisconsin and Illinois, Camille lent her expertise to lead areas of long-term care and public health, and she was a key planner and leader in implementing the first ever health plan for children in foster care. And she assumed leadership roles in the administration of maternal and child health programs, long-term care, housing and health plans for children, adults, and the elderly, and tobacco and chronic disease prevention programs. Camille holds a bachelor's degree in anthropology and a master's of public health administration and a master of jurisprudence and health law. And I am very happy to give Camille the floor. Welcome, Camille.
Thank you, Dr. Nolan, and hello, Mr. Thomas, President Thomas, and the Board of Health. Hello, staff. There's not much more I can say. I'm here to roll up my sleeves and work. I'm so excited to be here. I have so much to give, but so much to learn from this amazing group of staff that are here and all through the health department. The community has been so welcoming and all cliche, but I am so excited to be here and to lend my expertise where it's needed, to come along for the ride where things are already in flux and working well. I'm looking forward to the next several days and weeks where Dr. Nolan has made it possible that the leadership teams are inviting me to their team meetings, and we're looking forward to understanding together, Dr. Nolan and I, where we're going to share the care, right? So she's been doing so much. I think she deserves the attention here tonight and the thanks, because she's truly been an excellent leader and carrying all of the load. And I see some affirmative head nods from staff. I think that's a super important thing to say. And I'm looking forward to helping Dr. Nolan. And we're going to kind of parse out where we feel like fish in water, so that we can help guide staff, and she has a much more manageable workload ahead of her. So I can't wait for that to happen, Dr. Nolan. And Board of Health, I am here to work. I am excited, and I I know that there is much to do, but this staff, like I said, clearly and obviously, as you know, is already so good at what they do and so grounded in the community. And I can't wait to be the same. So I don't need much more time than that, certainly, because their work speaks for themselves. And I know there's a robust agenda ahead of us where they're going to share. And I'm going to be likely quite quiet because they've prepared for this meeting. I feel, like an observer at best, but they've prepared well for this meeting. And I hope that you find the information they've brought you sufficient and that it actually exceeds your expectations. So Dr. Nolan, I don't know if you have anything else you'd like to add about my short time, but thank you so much, President Thomas and all the Board of Health. Thank you.
And that's enough President Thomas's, Camille. You feel free to call me Greg. We're pretty informal on this board, and so while I appreciate
Thank you.
that,
I came from a place of wear a suit every day and very formal. So thank you for that correction. I'll take it well. Thank you, Greg.
Okay. All right, well, welcome. Yeah, we will definitely be getting to know each other quite a bit over the next month with our budget study session and our July meeting. So, but first, to just close out the formalities, we do have a quorum. And this regular meeting of the Boulder County Board of Health is called to the order at the discretion of the Executive Director, Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website, and due to the still ongoing COVID-19 pandemic, we are still conducting this board meeting electronically with a telephone in option, and that was all noticed correctly. We've already had item 1 on the agenda, which was Camille's introduction, and I will go to item 2 now, which is the public comments. So do we have anybody from the public who's speaking on unscheduled agenda items tonight? Okay, I am not hearing any. So we will go ahead and move to item 3, which is the May 10th, 2021 regular meeting minutes. If there are no call outs or questions, then Lexi.
I do have a correction on the May 10th minutes. Item 5 should read that the current vaccination rate, not the case rate, the vaccination rate for eligible populations was 74.9%, and that the 7-day average was 42.9 per 100,000, not percent.
Okay, important clarification. Thank you there, Lexi. So board, if that's okay, do I have a motion to adopt?
This is Brooke. I move to adopt the minutes with the correction.
This is Morgan. I can second that.
Okay, motion and a second. All in favor? Aye.
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 Okay, thank you. And now on to item 4, which is the update on the current COVID-19 pandemic.
Thank you. Yes, can you see my slides? Right.
Yep.
Okay. I am very pleased and happy and calm this evening to be able to present this data to you. We continue to move in a good direction in Boulder County. We are now at 74.5% of the eligible population, which is now 12 and up, has been vaccinated. It's an excellent rate. We are expecting to continue to climb up, but I will tell you that the increments are very slow day to day at this point. We have vaccinated 216,000 people in Boulder County to date with at least 1 vaccination. And we know that we have a population of about 335,000. So even considering under 12 population, we still have an excellent vaccination rate.
Lexi, can I ask a quick question?
Of course.
Does that include county residents that were vaccinated outside the county?
Yes.
Okay,
It is tracked by your home location.
just making sure. Thanks.
Thank you, Brooke. So if we look at our rates compared to our neighboring counties, we see that we are doing very well. You can see that leveling off continues. We're seeing that curve continuing to flatten. We were hoping to see a little bump from the big lottery that they put in place, but alas, we haven't seen that quite yet. Maybe next week. As I mentioned, our vaccinations are continuing to decline a little bit, although we're still seeing about 1,000 vaccinations a day, which is terrific. With summer here, we are hoping that people have maybe changed schedules that will allow them to get into vaccination clinics. We are continuing to support vaccination clinics, and we'll step our BCPH vaccination clinics back up in July after our staff get some respite, so that we can make sure to have access for evening hours and weekends for folks who are having trouble getting vaccinations in other spaces. If we take a look at the geographic distribution, you'll see that all of Boulder County is now over 25% vaccinated. And I'll just remind everybody that those tan spaces of lower vaccination rates are also largely spaces of lower population density. So there are fewer people in those spaces. So this is really starting to, become a lovely teal map for us. And if we look at the breakout.
Sorry, Lexi, before you get
Yep.
off of that last slide. So those pockets of 27%, 37% within, it looks like the city proper, can you address that at all?
I can, yes. Thank you for that question. That's a great question, because we know that that's not an underpopulated area. So thank you for that catch. Those are really the CU campus, and the reason that those are such light numbers is because most students they're not spaces where there's a heavy concentration of students. The students have home locations elsewhere. The vaccination is tracking people by their home location. So we do sometimes have student populations in the county who put their home location either in another county or that have residents off campus. So it's a little bit of an anomaly on the map. It's not a terribly helpful space on the map to look for where we need to target vaccinations, which is largely what we use the map for. This map, we can go into a really micro level and look down at census tracts and see what the vaccination rates at census tract level are, and we can deploy our teams to really be doing outreach at that census tract level. And that's what we largely use it for. So for that purpose, it's super helpful. For the purpose of saying, why do we have a low level of vaccinations in the middle of the city, it's less useful.
I appreciate the clarification. Thanks.
Absolutely. Good question. This is an image of a breakout of age groups for vaccination rates for partial and full courses. And what you can see now is that we have now crested 50% for the 12 to 19 age group, which is terrific because they have only been eligible for the vaccine for less than a month now for the 12 to 15-year-olds. So getting those numbers up is fantastic. And as I said, now that school's out, we are hoping that that number will continue to rise quickly, but that rate in that age group is very good compared to other state counties. Our 70 plus, as you can see, is 96% almost, which is amazing. And everyone over 50 is over 80% vaccinated, which bodes very well for our hospitalizations and unfortunately death rates going forward. We look like we're in good shape in those spaces, which is really important, not just for human health, but also for not overwhelming our health systems. We continue to see declining numbers of folks that are eligible for or that need the vaccine in various racial and ethnic groups and age groups. And we are starting to get down into triple numbers instead of quadruple and quintuple numbers in those spaces, which is fantastic. It's just, how do we create more and more targeted outreach efforts to really get those last few people in different kinds of groups. And we recognize that, we've got to start getting creative too, because each vaccination gets a little bit more difficult to get into an arm when you have so few people who are left to be vaccinated. And that is the update for vaccinations. I do have a couple of more comments before we move on to the next topic. I can just go back to my notes real quick. Our cases, so we are, in addition to vaccinations, we're looking at about 13 cases a day on average for the past week in Boulder County, which is about 4.1 people per 100,000 per day. Our positivity rate is now less than 1%. It's 0.9%. And we saw 4 people admitted to hospital in Boulder County last week for COVID. So, so far, we are definitely on track for allowing the public health order that puts us in level clear to expire as was planned in mid-August. The expiration of face coverings for 12 plus occurred last week. We allowed that public health order to expire. And the reason that we did that was a combination of reasons. We have excellent vaccine coverage in Boulder County. We have low and stable cases. Our hospitals are not overwhelmed, nor is our epidemiology team. And we were really moving to align with the state as well as our neighboring counties who had all stood down their masking orders. And so we really just felt like Boulder County was in a position to be able to go forward in alignment with the state without creating significant risk for our population. However, we are working to ensure clear messaging, especially around strong recommendations for schools and daycares to support masking for children who have not yet been vaccinated. While it's not required in all environments, there are still strong recommendations in some spaces. Particularly for kids that simply are not eligible to get vaccines yet. And we know that we want to protect our children until they are eligible for vaccinations. And one thing that I think is very heartening is that we still see a significant number of people continuing to mask in public spaces, even when they don't need to, and in spaces where I'm sure that the majority of people have been vaccinated. And that to me speaks to a population that recognizes the importance not only of protecting children, but also of setting an example and allowing people to feel comfortable continuing to wear masks and not to stigmatize that practice. Because I do think that that will be an ongoing need at times in our future as a community when we have surges, when we see the virus coming back in the fall, that there will be moments when we will want to encourage the public to go ahead and mask up again, and to know that they, are ready to do that is heartening. And we do have Kate Haywood here to answer any questions if folks have questions about the expiration of the mask order or this remaining existing public health order.
I think Morgan has a question.
Please, Morgan.
Oh, great. Thank you. So thanks, Lexi, and congratulations to the whole team. Really, the vaccination rate is so impressive. Even with the 12 to 19 is so awesome. So actually hats off to the community too, because I think the community has really responded to the call, which is great. Couple of demographic questions for you. One is about the cases that we are continuing to see. How are the numbers within 0 to 12, I guess, in terms of cases, and is that a factor? As I dropped off one of my children today to camp, and they said, no more mask wearing. I was like, oh, okay. So yeah. Curious about that. And then my second question about demographics is that, even though I think we're off to a strong start with youth vaccines from 12 to 19, there was a big disparity between white and Latinx youth. So just wondering what our strategy is there. Thank you.
Thank you. Both great questions. Our 0 to 12 cases are not super high. We are still seeing a few cases, and that plays out as kids are going to camp, and we, occasionally see something that creates a quarantine event, which I know for everybody is super frustrating. because it's like summer's here. We want everybody to be at camp, and there's so much fun to be had. But occasionally we still see parents who aren't following the guidelines, who are sending kids to camp sick and creating outbreak situations. So that is part of the reason why we're still strongly encouraging mask wearing indoors in particular. Outdoors, the science does not show transmission for outdoors, but if kids are indoors, whether it's camps or summer school or any other group environment, we really do encourage kids to continue to wear masks at any age if they can. I think what we're going to see, Morgan, is we're going to see guidelines for school quarantine and isolation going into the fall that really are predicated on what's the vaccination rate in the school, or for some kids, what's the vaccination rate in the community around the school, and that's really going to have an enormous bearing on whether we continue to need to quarantine kids or isolate kids. I think that, having a vaccination is going to get kids out of that, and we hope that that's part of the incentive for parents to fully vaccinate their kids once they're eligible. We are hoping that Pfizer, they're still saying September for Pfizer right now. I'm holding out hope against hope that, they can manage to get it through a little bit faster so that we can have things a little better set up for the fall. But we may not. We may have to go through for the first few months and really keep track with and encourage masking. But I think that's what you're seeing is that, we're having a few people who aren't following the rules. It does feel like everybody wants to take their mask off, and we just, if we can hold people in place a little bit longer, especially for kids that have health issues and are really at risk of contracting this disease, having serious complications from it, that would be super helpful. Your second question was about youth vaccinations. We are launching some specific outreach initiatives and communications campaigns to target youth and to do it in culturally responsive ways, including for the Latinx community, LGBTQ, and developing some things in partnership with our community ambassador partners to build some outreach and some coordinated campaigns in that space.
Great. Thanks, Lexi, for that.
Yeah, the last thing that I'll say is we're also looking at opportunities to support vaccination clinics for kids that are in sports camps and things like that over the summer to try to boost that rate, especially among 12 to 18-year-olds.
Brooke?
So a follow-up question to Morgan's question, and this might be just to clarify and to make sure my assumption is correct. Are positive cases, have those all been in unvaccinated people, or have we seen any cases test positive with the vaccine?
It's a great question, Brooke. I can't answer the question specifically for Boulder County, but what I can tell you is that the vast majority of cases that we're seeing statewide, nationally, are in folks who are unvaccinated. And I will also tell you that that holds true for hospitalizations and deaths too. Okay. I don't have specific information on Boulder County. Chris, is that something you know?
I do not. We'd have to get back to you.
Okay. I was just curious. Yeah. And then also you had mentioned mass stigmatization. Has that been an issue in Boulder? I know it has been in other counties, but I'm just curious if it has been an issue here.
I haven't heard any cases of it yet, Brooke, but, we look a lot to our sister communities because, people come across the border all the time. We have so much traffic in and out of Boulder County that, we don't have a nice red line across the county. We just have so much transfer in and out that we do have to kind of pay attention to what we see happening.
Thank you.
And Lexi, this is Chris Campbell again. Hi, everyone. I'm the Emergency Coordinator of Public Health. Good to see you all. Morgan, I just wanted to add a couple points on the vaccine strategy, and the positive thing. Actually, the summer is flying by very quickly. Our Boulder County clinics that'll be held at the community hub. We're removing those barriers. They're going to be available in the evenings and on the weekends, and so those that actually is going to start next week, which is amazing. So
Oh.
we have a little bit of respite time for our staff, and definitely ready to continue to vaccinate. We're also excited. It looks like the Moderna vaccine will see an emergency use authorization pretty quickly. Maybe even, I know the advisory committee is looking at this Friday, I believe, which will help our Boulder County Public Health clinics. And really our big focus and shift working with community ambassadors and the larger cultural brokers in the community are on families and making providing information, answering questions to make that good decision to get vaccinated as a family. Our partners with Clinic and Salute are shifting hours as well and have shifted hours. So some of those barriers around accessibility we're running into last time we met with you all and presented the board. We feel like those have all shifted. And additionally, we're really leveraging the resources of the CDPHE is continue to invest in. These include, these are equity clinics they support. The City of Boulder's had some great clinics working with unhoused and unsheltered community members. This past weekend had great success, about 100 community members vaccinated. So those are lots of strategies out there we feel are working pretty well. Throughout the summer, we really are going to look at that, a big education, family-focused strategy, really culturally appropriate, looking at those opportunities to connect with, connect in places that, in businesses or festivals or those kind of things. We're really digging into that in the next couple weeks with our community ambassadors and cultural brokers. So we feel okay. The hard work remains. We know that looking at the vaccination numbers, but we feel pretty good about heading into to the rest of the summer.
Hey, Chris, are you hearing or seeing any kind of themes I noticed on the slide, and maybe it's just a couple data points, and so I should just ignore it, but where the majority of people in the recent days who've gotten the vaccine, it's their first dose. And so are there reasons why now they're starting to get their first dose, and maybe it's just an age thing, that's it?
I don't know if I can answer that one for you. I think it's you touched on a couple factors there. I think the incentives might be having some impact. So we're seeing, already starting to award some of the incentives. So some scholarships have been awarded, and I believe some even maybe some youth in Boulder County might have gotten those scholarships. We'll have to look at that. So I heard that recently. So that could be potentially part of it. Yeah, I think if you look at it, you can also go back and really dig into the timing of the first dose and the second dose, and that might be why we're not seeing the numbers have definitely gone down in the first doses. We had that trajectory downward a bit, and so we're not seeing as many second doses quite yet. It's pretty fluid. Yeah, I don't know if I have a
yeah, I was guessing that was your answer, but thank you anyway.
Yeah.
And then recovery plan, do we want to talk about that?
Yeah, I can. Thanks, Ray, and I can go ahead and take that. So again, great to see the board and community members joining the meeting here. My name is Chris Campbell, and again, I'm the emergency manager with Boulder County Public Health. Let me share my screen, and it is a pretty remarkable time to continue to have this conversation with the board that we are starting to, as an agency and a community, talk about recovery. And someone can verify they can see that Teams looks different every time we come on it now. So it's fascinating.
I can see it.
Okay, great. Thank you. So I just wanted to give a real brief, and it's pretty high level. Certainly, we did share our recovery plan. It's an internal Boulder County Public Health recovery plan. We did share that with board members, and certainly can talk any details if you have questions. But we want to give you an overview of where we're at with looking at and really starting to transition for our agency and into recovery. As Lexi mentioned, one of the things that is really moving this direction is incredible work that the community has done and we have done together with vaccines. So it's now time to really start to look at a transition into recovery and really ensuring that the community is in a good place in our agency. We did a little research, and certainly in the emergency management world, and if you look at recoveries, for example, from the 2013 flood and natural disasters, you have a kind of typical recovery approach or phasing. Pandemic, and particularly this pandemic, has been a little different. So, we did do some research, and Dara Goodrell and our emergency management teams really looked into this. It's a longer kind of recovery from a pandemic, and we really liked this framework we're looking at, and so this is what we're following with our recovery plan. Certainly want the community to understand that we're very much still in a response phase with the pandemic. You've heard some of the discussion about that, and ensuring that we truly, as a community, can move to the other side of the pandemic. See this transition phase, which is kind of normally a recovery phase, and then maybe moving into a post-pandemic phase, and really moving into that, really looking at how do we prepare for potential next pandemic, which we certainly don't want to discuss that now, but it gives a little sense of how we're framing our recovery plan. And these phases are longer, and they're going to be long-term. So we want to really dig into this as an agency and a community. Some of the assumptions of the plan, just to share with you, very focused on recovery for our staff and an agency. Our teams have done incredible work over the past 14 months, and we want to discuss and make sure that we have everything in place for a strong recovery for the community and clients. And we'll continue to transition our current core work. We're going to continue that as an agency for the response. So our epidemiology teams really looking at mitigation and containment. You've heard some policy. We continue to discuss that. So this is all continuing to transition into our day-to-day operations. I'll talk a little bit more about that. Certainly, health equity and racial equity frame everything we do, and this is no different from our recovery plan. In fact, this is first, and it's really at the top of mind in front of our work with our recovery plan. So that's really going to frame our strategies and how we implement our recovery strategies. This is an internal plan, and ultimately you will hear more from staff and certainly from the Board of County Commissioners about the larger recovery for the county. This is an internal plan that will really tie into that larger recovery structure. Some of the goals and really where we're at now. We talked about this, what the continued response work we're doing, really trying to restore staff back to some manageable workloads. And we've really seen that in the last couple of weeks. It's great to see. I've seen staff, I think, from a mental health perspective, and really just they seem upbeat and have a lot more energy. They've had some time to get a little bit of time off. It's remarkable to see. And we had to be intentional about that. It was a tough transition to do that. And we're really digging into, and certainly Lexi can speak to this in the future if she's not going to speak to it in the meeting, our long-term staffing needs to meet these goals and right sizing of our teams. We're seeing that now and really digging into that. So, we feel like we're in a pretty good place there. And we talked about respite and recovery. So we continue to do that. And we feel like as an agency and as teams, we're making good progress on that. Longer term goals, I mentioned aligning with the Boulder County Recovery Plan. So this is the larger kind of systemic work we need to do as a community and as a county to really recover from this unprecedented pandemic. Community engagement is one thing we'll continue to talk about with this board and the community. Certainly, we want the community to continue to drive our recovery. And we've learned, from our vaccine equity strategies, for example, how grassroots, community-driven approaches have been really effective, and we want to continue that work. We'll continue to work on policy to support to support that systemic change. Certainly focus on our agency priorities, and we have opportunities as we move into this bigger picture of recovery to focus on mental health, climate action, and health equity. So this plan looks forward to working on that. I do want to mention, our emergency operations plan for public health, our pandemic response plan. These are all things really that we have to look at lessons learned. We're going through a second iteration of an after action process internally and with our community partners. We're not going to miss this opportunity to make improvements. And really, through a health equity lens, we know we have work to do. We want that to be front and center with all of our plans in the future and with any kind of response. So we're really going to dig into that as part of this recovery plan. Just about done my presentation. We do have a structure to support this. And this is really kind of a shadow structure that fits within Boulder County Public Health, Board of Health, providing policy direction. The good thing about this is it's staff that are working in various areas. So we just want to make sure they had a clear recovery structure to work under. And that's what this shows. And I just want to take the opportunity again. I think it's pretty amazing to be having this conversation with the board and with the community tonight to talk about recovery, to be at this point. So we're excited. We want to thank the board for their leadership. We want to thank the community for everything they've done and where we're at. And I'd be happy to answer any questions about the recovery plan.
Thanks, Chris.
I have
Go ahead, Brooke.
Yeah, I have a question, and this might be a bit far out, but you talk about preparation and, the third point, the emergency management plan. I'm not sure what we're allowed to track when people get vaccinated, but has there been any consideration of creating some sort of priority vaccination list so that in the future we could be really ready to go and not relying on trying to pull people in, but being really targeted? Like, here are all the 75 plus members of the community that are eligible for vaccination, go directly to them. You know what I mean? And also avoid some of the, say, people slipping through who were saying, I'm a health worker and getting vaccinated. I just think that a list would have really helped.
Yeah, I think those are interesting points. I think generally, again, we want to capture some of those lessons learned, and I think if we take a step back and recall, really how the governor's office went through the phasing with the community, how we had a lot of shifts there. We learned a lot about the vaccination strategy. I think there's a lot of lessons learned we could capture there. I don't know about a list. We do have a list in CIS, for example. The state right now is already doing, for example, they're able to do what are called callbacks if someone is overdue for their second dose. So there might be some lessons learned to send an additional message out if there's a booster available, for example, for certain community members, depending on, in the future, maybe in early 2022, that's something that happens. So, I certainly want to capture some of those lessons learned and have those in our plans. I want to make sure again that those lessons we learned around health equity and the vaccine equity are ones we capture, and just again, working with our community ambassadors has been amazing. They helped us really work through having culturally relevant, appropriate, and welcoming clinics. We'll do that from now on. We'll do that with our regular clinics at the county. So that's just one example where I think we'll have a better response, a better support of the community.
I would just add that, thanks, Chris. Brooke, it's a really good question. I think what you're really getting at is, are we in a better place now than we were, right?
Yeah, exactly. Like, as beyond just the health equity lessons,
right,
have we learned bigger lessons about preparedness?
And so you're absolutely right. And I think one thing that's really critical to remember and also hard to manage is that these conversations about what does preparedness look like for the next pandemic are happening in Boulder County and at the state and at the national level and at the international level. And we have, the luxury is that we'll have a little bit more time to learn from each other about what's going on, who's doing what, so that we can maybe hopefully better integrate a little bit. Because I think that was one of the real challenges of the pandemic, was that everybody was expected to turn on a dime. And, so we ended up with the systems that we ended up with, which weren't perfect, but certainly provide, an architecture to build on and some systems to build on. And, we know we have problems with the SIS. The information that's in SIS is not accurate for a lot of the race ethnicity questions. They've missed a lot of folks that they've labeled as white that are probably Hispanic or Latinx. So, kind of tweaking those systems, but also really being able to use them and deploy them more effectively from the start, I think is part of, the big picture. How do we make sure that work is happening at the state level and frankly at the national level too, so that we have more integrated systems. But I appreciate the question a lot.
Yeah, thank you.
Morgan.
Yeah, thank you. And super helpful overview, Chris. Thank you. And my two follow-up things. One is that I think it's great that you're capturing the health equity lessons learned, because whether or not it's another pandemic or it's a flood or it's a fire, right? How can we ensure that we are in a better position to have a more equitable response next go round? And again, that's, I think the staff has done a tremendous job, but I think we can always capture those lessons learned and build better relationships and, improve for whatever the next response needed is. And then my second question is about just, offering up, I guess, how can we support the leadership team and the rest of the staff in just honoring the work that they've put in the last year and a half, right? So if there's some way that we can, as a board, do that in some way that would be meaningful, please let us know, because I think the board is really open to those suggestions, and we do really want to let the staff know how appreciative we are. And I know most of the staff does not attend these meetings, so how can we ensure that is communicated to them? Would love your recommendations on that.
Thanks, Morgan. I would love to mull that one over just a little bit and to come back to you on it. We probably are going to have an ask for recognizing our volunteer force that was absolutely incredible and stepped in so many spaces, but those aren't BCPH staff. But I would really like to talk to the team, to the management team a little bit more with Camille about kind of what they might feel like would feel really meaningful to them. Thank you for that very much.
Any other questions?
So on the return to office type plans, when do we anticipate the board being back in person, these meetings?
I think that's a great question, Camille. We'll have to talk about that. I mean, theoretically, it could happen in July if everybody's up for it. We could make it happen.
Yeah, I was going to talk about that in new business, but doesn't hurt to talk about it now or think about it now. We do have our budget study session toward the end of June. And then, of course, we'll have our regular meeting the second Monday of July. So, yeah, I think that's a good target, July board meeting.
In fact, Camille just approved the return to client services policy for our teams who are now ready to get back in person with their families, which is super helpful as we go, as we kind of really dig down into recovery and recognize some of the spaces where, remote and online support has been great, but maybe not everything that we wish it could have been for every family. So we're definitely moving in those spaces, and our return to office planning is coming along. We're almost finalizing our telework policy and hoping to start bringing folks back probably sometime in July as we can.
I think another important consideration, and I'm not exactly sure how long it'll take to figure it out, but for those who are returning to the office with some kind of hybrid, work schedule, the ability to still have remote participation in meetings, I think is still important. And, I do think it's probably as or more important for the general public because, in a variety of forums, they have been able to participate more by not having to worry about all the logistics of getting to a meeting and all that comes with that. So, we don't need to figure that out right away, but when we do return in person, I would suspect we still might have an ability to listen in remotely.
So that's great. So we've talked about hybrid staff work, and we've talked about making sure that people still have, that the public still has options for remote, online, or in-person services, whether it's vital records or licenses for things. But I will definitely make a note, Greg, because I think that the point about how do we make sure that we create opportunities for hybrid community meetings, especially with the public or with our partners, I think that's a really important question, and I'm not sure we've explicitly thought about that. So we'll take that one back with us, won't we, Camille?
All right. Do we cover the broader agency recovery on that update, or do we need to still discuss that?
Nope. I'm ready for it if you are.
Okay. Thank you, Chris. Appreciate all your help.
Thanks, Chris.
Thank you.
Great. So in relation to pandemic response, you can see from Chris's presentation that we're working to adapt to ongoing public health response needs, pandemic response needs, and thinking carefully about how we properly support and resource that need, given our best projections of not just future pandemics, but pandemic surges, right, in the nearer term, and what that will look like for our agency response. We have moved some temporary response staff to lower cost term positions in the agency if they're going to continue with us for a significant period of time, which saves a lot of money. We have stood down or consolidated some teams as the need lessened, and we have been able to return a lot of folks, a lot of staff to their regular work that we had pulled into pandemic response. So really right-sizing those teams is where we've been focused for the past month. For instance, we have an urgent need to get our restaurant and childcare inspection teams back in place so that they can make sure that those are safe spaces and those folks have their licenses in order. And it also generates money for public health that pays the salaries of those folks. So we're also continuing our partnership with 6 community-based organizations who represent priority populations, including the Latinx community, LGBTQ, disabled, and mountain community populations. These partners serve as community ambassadors, and they have been absolutely instrumental in helping us to achieve the high levels of vaccination rates we see in Boulder County. We are hoping to continue to build on these relationships and the work that we did together in pandemic response through recovery, and to strengthen public health's work in a wider array of our programs to advance racial equity and health equity going forward. We're also making programmatic staffing and resourcing adjustments to move toward pandemic recovery more generally, and we've been identifying some urgent community needs and immediate steps we can take to address needs and the resources that will be needed to make that happen. So in particular, we're seeing significant needs, for instance, for mental and behavioral health supports, especially for youth, LGBTQ populations, and lower income families, as well as increased demand for clean syringes. We recognize the need for an innovative approach to reaching large populations with positive mental health supports, given the breadth of demand in our community for support. And we're thinking carefully about how we can scale support, recognizing that a highly trained clinical workforce is unlikely to suddenly significantly emerge in Boulder County in the next 2 years, but we need to have some kind of response to the community need now. So we're thinking very hard about how do we make that happen. We're also seeing continued high levels of food insecurity and are looking for funding opportunities to increase direct support from our existing programs to families, including those who are ineligible for federal programs for various reasons, and to also do it in a way that supports local agriculture. We're looking at continued support to a stressed out, overworked, and heroic public health staff, and also how we can deepen recovery work within our upcoming planning processes, normal public health cyclical planning processes, including the community health needs assessment that we'll be conducting this fall. So in order to support all of that projected work in relation to community needs, we're really working diligently on several budgets simultaneously. First, the 2022 Board of Health budget study session will be on June 28th, and we'll present a draft budget that will inform the county's larger budgeting process in August. So our budget will then go to the county and be combined with theirs so that we can reconcile them. Second, BCPH is submitting a request to the county commissioners for ARPA funding to support urgent community needs related to pandemic response and recovery. Depending on the county's response to that request, this may create some adjustments for the 2022 budget at a later date, but it'll also affect the 2021 amended budget more immediately. Consequently, we will submit the 2021 amended budget to the Board of Health after the county has reviewed and decided on our ARPA request, and following some additional funding possibilities that we may hear about from the state and federal level. So that amended 2021 budget may not come to you until September, because we would like to do it efficiently and not request that you do it multiple times. Finally, public health is thinking carefully about where the transformational opportunities are to advance health and racial equity through public health action and addressing root causes of inequities in Boulder County over the next several years. And these conversations are taking place in partnership with partners within county government, community-based organizations and nonprofits, agencies, and thought leaders, and we'll be spending time over the next several months to really ground truth these ideas, to assess impact on health and health equity of the actions, to build out strategies and innovative programming, and to identify opportunities for alignment, scale, funding, and sustainability. So we're working on hiring some important positions too in public health right now, and advancing the climate change strategic plan in collaboration with the county, and embedding that work across our division programs. You know, I could talk for a lot longer about other things that we're doing, but I'll close it there. And happy to answer any questions about kind of where our head is in public health right now.
That's a lot going on, especially with the budget. But the good news is, you know, there's still a lot of focus on that response. It'll be really interesting to see from a, not necessarily from a public health standpoint, but from a community standpoint, as we go through the summer and as the case numbers continue to drop and hopefully linger at a low level. If we see, you know, what happens with variants come flu season again, be interesting also to see how people's behavior regarding masks during flu season, if we're just assuming that COVID vaccinations are covering us this fall and winter, see how that kind of plays out again, to see if we see more masks in the fall. Because, I mean, yeah, we've all seen the stories on how non-existent this flu season really was, and it'll be really interesting to see that kind of case wrap up. I did have a question that I didn't ask earlier, and Lexi or Chris, you can probably answer this, but you know, usually with any kind of FEMA response, there is an after action report that's required. Have we done any after action reports? And will there be kind of a more comprehensive one if we've done already, once, let's say it's later this summer and they say, okay, this seems to be a good time to just say, all right, everybody give us all your experiences over the past year and a half.
Yeah, thanks, Greg. So we have done a first kind of iteration of that it was actually back in November that we did an after action. This is with about 100 response staff, and we have an overall report for that. And we are now looking at doing a more comprehensive AAR, mostly with all internal staff through surveys. We have already started also to survey and gather data from community partners or response partners. I see this though really being a ultimately much bigger. As Lexi mentioned, I see us. We're gathering all the ARs out there. So, for example, the North Central Region Healthcare Coalition has done an after action process or is in the process of doing that. So we'll gather all those, and our goal is to put that into a comprehensive report along with an improvement plan. So having things down and actions we can take that will lead us to again continuous quality improvement. So to answer your question, yes, and it's something we can certainly share with the board. It'll be a pretty long term. We hope to have something certainly with our staff and some key community partners pretty quickly in the summer. The more comprehensive one, even with the state, I would see happening here in the future if folks are starting to come out of that response stance and probably take a pretty comprehensive look at the response.
Yeah, we'll look forward to that. Any other questions on the COVID-19 updates to the board? Okay, thank you very much, everybody, for your continued hard work on this. It sure is a good feeling right now, at least as we head into summer. All right, let's see. Next up on the agenda is item number 5, the director's report. Lexi, do you have anything you want to call out, or would you prefer to just have questions?
I think given my lengthy agency recovery report, I will forego any further discussion from the director's report. Thanks to staff for consistently always submitting such good material for the board so that they have a chance to really understand what's happening down at our program level. And we're happy to take any questions.
Well, this isn't really a question, but it is a little sad moment, I guess, or happy moment for Tammy. But I saw in the director's report that Tammy's retiring. Good for you, Tammy. You've done an excellent job. I've been on the board for not quite 10 years, and I think we only had one meeting where something fell through where we didn't have a quorum, and we had to cancel the meeting. So between you and lately Rita assisting, you guys have done an amazing job. I'm going to really miss seeing your smile and seeing your face. But, I already got the news because I bumped into her at the flower bin. So
Yeah.
Anyway, we're going to miss you, Tammy, and kudos to excellent record of service.
Well, thank you.
Yeah.
I'm echoing those good wishes and sadness that we're losing you, Tammy, but wishing you all the best in the next chapter.
Thank you.
And I also want to add that Tammy delayed her retirement to wait until things calmed down a little bit and until new director came on. And so, Tammy, you have my undying appreciation. And just a secret, Tammy's the one that runs all of the Board of Health stuff. You guys probably know that. It's not much of a secret. It's a poorly kept secret, but she really, she was absolutely made it happen when I had no idea what I was doing. And so thank you, Tammy, and thanks, Rita, for stepping in and learning Tammy's work in this space and taking us forward with it.
Well, thank you. I just want to say that it's been an honor and a privilege to support the Board of Health. I've been doing it for almost 28 years now, so that time has flown by. It's like when I started, my daughter, I would bring her into the office, and now she works for public health. So, but it's we've handled so many challenges over the years, from the wildfires to the flood. to COVID this past year. And, you know, I'm just really proud of our agency and the Board of Health. We are so fortunate to have such a supportive board. You've heard many, many times from others that other counties do not have such great support. And so I just really want to, you know, thank you for that and tell you I'm going to miss you, but not enough to keep me off of those airplanes. As you can tell from my background, you know, Hawaii is like a second home for me. So I already have 2 trips planned there. So thank you. It's been a real honor working with y'all.
You too. Any other items, questions from board members on the director's report?
I had a question. I had never heard of this before. What are the syringe litter walks? Is that something that the Works organizes?
It is. I don't think George is on the call today to be your straight from the horse's mouth response, but I think it relates to organized events to make sure that syringes aren't creating trash around the community. There are often places where they are left behind that are you know, fall into a pattern that we can sweep.
All right, I'll reach out to him. Thanks.
Georgia Babatsikos is the director of our Works program.
I'll just jump in to say, I also noted in the director's report that Sheila has taken off on a different position, which I'm happy for her. It sounds like it's a great opportunity, and disappointed for BCPH, and just thinking about how do we continue to drive towards equity and also hold on to great staff that are doing equity work for us too. So I don't know that there's anything to say there other than it seems like we could, I don't know, it needs to be a priority.
And I will tell you, Morgan, it absolutely is a priority. And it's such a priority that we don't want to rush it too quickly. We want to be really thoughtful about what our health equity leadership needs are for the next couple of years. And so what we're going to do is take a month or two to really think carefully about that position and to think about what the work that's starting to emerge looking forward is going to look like, and where we're going to really need some leadership and what those skills and experiences are that really define that strong leadership. In the interim, what we're doing is Marcy Campbell has been supporting Sheila for many months on the Health Equity Coordinating Committee. Marcy's going to be co-leading that committee to continue to take the work forward. We have some significant contracts in place to work with the Gemini Group to advance racial equity and health equity training with our staff over the next few months. So that's exciting. We have some national public speakers coming in to talk about things like narrative and framing equity issues. We have other internal training opportunities happening. The VEC work that Sheila was leading has been transitioned over to Carmen Ramirez from Longmont, who is phenomenal, and our own Lizbeth Mendoza. And they're doing spectacular work continuing on with the community ambassadors in that space. And we'll be recruiting from our HEC staff, from our Health Equity Coordinating Committee staff, a second co-lead for the committee in the interim. We're hoping to identify someone on staff that has experience in that space that is a person of color, and we're running that recruitment process through our Equitable Leadership Initiative that we created a few months ago to really ensure that there is real opportunity for public health staff to step into leadership spaces in intentional ways, and so that we are creating those opportunities for our staff to find new leadership opportunities. So hopefully we'll be moving the hiring process forward too, but I don't think that any of the work's going to slow down in the meantime.
That's helpful to hear, Lexi. Thank you. And I guess, maybe what I can do is plant a seed for at some point as we continue to have more space and time, hopefully freeing up on COVID parts of our meetings. It would be great to have a formal presentation of some of what some of what you just talked about, because it was a lot, but how that's responding to the Gemini report and just what staff is doing,
Great.
what leadership's doing to drive towards equity and make those transitions. So it would be great to have that be formally part of the board agenda at some point.
Absolutely. It's a great idea.
Awesome. Thank you.
I just wanted to give a shout out to the water quality team. I don't think I've done that before, but saw that all the OWTS permit applications can now be completed online. So Joe, Aaron, and staff, great job there. I also see the stormwater quality permit is potentially an issue going forward. Denver just got their permit earlier this year, and there is definitely an increased level of stringency. And while some of that is good, some of it seems burdensome for the benefit that potentially is gained. So that's a lot of hard work in that stormwater quality arena. And the water quality arena. So good job to everybody in those programs.
And just an additional shout out, those transition to online services are also supported by our IT team and Dina Revis in particular. So thanks to them for helping move that along with the county.
Agreed. Okay, well, going once, going twice. Any old and new business for our members or Lexi? I don't have anything. Okay, well, it looked on paper to be a fairly quick meeting, and it was. So thank you, everybody, for your participation and attendance. Looking forward to the next couple months, and to all the BCPH staff. I really do hope, we really do hope that you get all the rest and relaxation and support that you need. Transitioning back to our old jobs after 15 months is not as easy as it seemed or sounded when this all started, and we said, I can't wait till I'm back to my regular work. But I do think with every kind of obstacle or challenge, there's an opportunity to kind of rethink what we've done and make it better. So, but please take that time to get yourselves, well mentally and, especially for me physically. So with that, we will adjourn. So thank you, everybody, and we'll see you in a couple weeks for the budget study session.
Thanks so much.
Thank you.
And we'll talk soon, Camille. Bye.
Thanks, everyone.
Bye.
Thank you.
Bye.